Thank you. So good afternoon to everybody. I'll be the last one. I hope the introduction of our colleague from WHO will help to follow some of the steps that we did locally and then nationally, and then we will understand why the global strategy is the key point to respond to any outbreak of dengue. Anyhow, just to frame people, the Ministry of Health in Portugal has a specific body called Directorate General of Health that is responsible for surveillance and response within public health all over. So we kind of have a normative responsibility to provide guidelines and to provide with strategies and plans that should be applied at regional and local level. When local and regional resources are not able to cope with some public health demands, we intervene. That's the very few areas where we intervene. Otherwise, it's by the local and regional authorities. All right, so my presentation will be about the big challenge we had in Portugal last year, and how we coped with it and how we keep on responding to the challenge. As you see, the presentation has contribution for my direct colleagues who works alert unit, response unit, regional at Madeira. Okay? So whatever I'm going to say, we are going to try to show how we came from the outbreak detection and how we went through and build up the response, but also some strategy to keep on following it. For the one who doesn't know, this is where the place is. More than 500 kilometers from the coast of Africa, a little bit further of 700 to Portugal. That's an autonomous region of Madeira, and the outbreak was specific on the island. So why was this so important? Oh, just one word, death. And what do we heard about it before? We knew something. Within 2005 was the first time we detected the vector. Aedes aegypti was not in the island before that year. There are some ideas that it was brought from air, with many travel coming from Venezuela and other countries in South America, because there are a lot of family from Madeira that migrated for those South American countries, and there are a lot of human change through the all year round, especially for Christmas and other celebrations. But no cases, no human cases was detected till then. But before, because there were already some vector surveillance within general vectors who could detect this, and for many years, from 2006 till 2012, already some actions were done to alert people within this specific vector. And nothing was mentioned on diseases those days, because it never raised the issue by then. But just to have an idea, in 2008 we used already some of the slogan that you are so well familiar with. So the detection, strangely enough, was by the clinical doctors and practitioners who started to find out there were a lot of people coming to the first aid departments or the emergency department with just general flu, with some joint pain, something not specific as a flu-like syndrome, but for some weeks someone decided to ask some laboratory analysis, and then when the results showed up on 2 confirmed samples to the national lab, then the alert was raised. And to understand better, as I said at the beginning, when you have the local authorities, even in the autonomous region of Madeira, they have to report to the national authorities through the network. And the alert came at the national level. And then it comes to us, our department, who's responsible to detect any alert in public health and coordinate the response. So this was the first things we could cope with. For sure, increase the clinical awareness. For sure, take some measures on blood. Reinforce the vector surveillance and control. And try faster as possible to get the national help, because local resources on public health were not so many. And we had the EU collaboration by ECDC that in few time could go and support the regional. So, very important, the first actions at regional level came to the national capacity to respond. We did a very fast, rapid risk assessment. We set a task force able to understand and to cope with all dimensions of the outbreak: vector, human cases, multisectoral capacity, international support through, in this case, ECDC, and to try to cope with all the media demand and all the peculiar questions that the health professionals were raising. So we start to produce already guidelines and clinical recommendations to support this very strong key element when we respond to a dengue outbreak that you don't know which kind it is on the first signs, and able to at least have a very good response. And of course, with the ongoing of the situation, we would understand it better by the outbreak response team from ECDC that supported the investigation of the outbreak itself, together with the national authorities. So together with ECDC colleagues, one of them are here. Joseph, I'm not sure if he left already to the plane. Myself and other 3 experts, we joined the regional authorities in Madeira, and we supported the outbreak investigation and response. So this is just an overview. I'm not going to go through all these epidemiological aspects, but just for you to have a clear idea, case definitions were in place immediately, and a surveillance system with informatics support was put in place for public and private health services. Just an overview of data on around the beginning of 2012, just to have some numbers of the publications that was done by then. Important of all, this. And, of course, the responsibility within Europe. Imported cases were reported all the time, and we were under pressure. Besides that, these are the list of many measures that has been taken that is easy to summarize in the elements that the global strategy of WHO shows. It's not, I don't want to go through this long because time is running against us, but just to have an idea, all the slides will be available to, and you can follow multi-approaches that were taken. One of the most interesting one, because it exists already, it's our national public health hotline, that it's also at the regional level, and it's supported also in kind of guiding people on the symptoms and on providing information and reducing also the demand of the services. And we had guests and we had experts coming, and they talked good about the few resources we had and the capacity to cope with the outbreak. And all the measures we took, they are a little bit innovated. We had to be a little bit strong because we could not know the onset of the outbreak. So we decided that the blood safety measures should be a little bit longer within the time that was on the previous guidelines for dengue. So they became a little bit a reference from there. Again, as I told you, we have registrations of phone calls and things related to dengue and how the hotline provided some support also. And finally, we could say we have the outbreak controlled. This was based not only in the reduction of the vector activity, but also with the blood samples from donors indicating that for sure we'd had 0 cases. And after many 3 weeks of 0 cases of dengue, we considered it controlled. Nevertheless, the situation could not be accepted to be controlled. We have a vector in the island that became infected and caused an outbreak. So this is again the summary why we think it happened. So Madeira has specific climate conditions that supports the breeding of this specific vector. It has a strong relation with tourism, migration, moving of people from many other areas and from endemic areas. There is a lot of urban flora. This is one of the typical aspects of the island. Everyone likes to have their own pots with their own flowers everywhere where there is a window, a veranda, a balcony, and they breed also mosquitoes besides flowers. There are these traditions of, and also this geographic with mountains and bays and all these different altitudes. And within 2012, it was prolonged warm temperature and prolonged wet season. And that could be the specific environment condition that supported the outbreak onset. So, nevertheless, the key answer to this is keep on monitoring, keep surveillance, because that's the key for detection. So, all right, we had the outbreak. We keep on monitoring every single week. And we still use confirmation lab to be sure. And we keep on monitoring what are the cases that's getting in. And we keep on knowing what else is coming out there, where are new outbreaks. Recent one in Angola. In Portugal, peculiar, we get 9 imported cases. This is an ECDC rapid communication and aerial surveillance. It raises still. Keep on looking, and we keep on looking. These are last data in mainland Portugal, imported cases. And we keep on understanding that the vector monitoring has also to go through temperature, rainfall, and other kind of determinants that will make us understand if an outbreak can show again or not. And we keep on this. This peculiar program is the national program of vector surveillance that exists before this outbreak, and that's also allowed to detect the increase of vectors activities in different species. It's national-wide, Azores, Madeira, and the continent. And we keep on doing it, using traps and ovid traps. They were that little, and they are this amount. And we keep on publishing everything about the vector monitoring. We keep on not forgetting all collection of data and try to make it together understandable like Google does. We can foresee something. We keep on doing vector control in typical specific areas. Don't forget this vector lives by human urban areas, not in the wild forests. They need the human activities to have the breeding places. So, and we keep on knowing that we have resistance to insecticides, and we know how to keep a very strong surveillance system and how to keep the informatics system running to support, how to update the guidelines and the clinical recommendations, and to keep strong meetings and to talk about it and exchange experience, and to keep the world outside informed about what we know in all languages, in ports, in airports, doing specific inquiries in high season when people start to come on this summertime, Easter time, Christmas time. We know where the vector is and the other vectors that put problem in Europe. This is Aedes albopictus map, and this is the one that we have in Madeira, located only there, and more increases time, and the rest, as you know. And learning process, good reference, WHO, with the specific goals and the 5 technical approaches. Of course, within the 5 technical approaches, we wait for international development of vaccines. We wait for worldwide investigation and use it. Information for knowledge, knowledge for action. And from that specific global strategies, some local, sorry for the Portuguese, but it's easy to understand that you come up from a specific instruction for a response and contingency plan, from when you have just sporadic case, when you have an alert of an outbreak, during the outbreak, and out of the outbreak. So this is the main intervention actions you want to have, and the indicators to be sure you are doing something good and you can assess it and evaluate it. And there are a lot of technical improvements that has been done. Sorry again for the Portuguese, but very easy. It's used a lot of the WHO words: coordination and intersectoral collaboration, technical and scientific knowledge, operational research, technical support, and scientific knowledge to support vector control, to short and medium long-term methods, information within epidemiology and vector control, geographic information system, monitoring of the outbreak periods, communication and contingency plan, and lesson learns. So dengue is one of the 17 diseases listed on the neglected tropical diseases, and this is at national level, the official documentation saying this is a national priority, and we have a group of experts in public health and vector control to have to coordinate the national. This is all the involved we have within this national task force, and these are the things we have been learned and mentioned already on the previous slides. And these are the keywords of the 5 process things that WHO Global Strategy says to us. More important, coordination and collaboration do have a strong impact when you have few resources. Thank you.